Can you repeat just what you told me to my wife here present?
Rite Aid has a very strict policy for controlled substances, and we have a 6-step policy that we have to follow, and in order to keep patients safe with
Okay.
in order with controlled substances, and there's an overlap of an extended release medication. If there's an overlap, it for patient safety, we do not fill overlaps of controlled substances.
So which ones overlap?
The Opana ER that was already picked up.
But you
and this
didn't even want to
Dilaudid
pick it up and
ER.
give him the price, correct, and put on hold.
Well, we can't put it on hold because they don't allow us to put any prescriptions on hold. Kwong, the pharmacy manager, does not allow us to hold any prescriptions.
Who doesn't?
Kwong, the pharmacy manager.
Okay.
He doesn't want us to hold any. Either we fill it or you take it back, and then you bring it back.
Okay.
And each pharmacist has to make the decision as far as if they're going to fill it or not fill it. And my decision, based on safety, is I am unable to fill it for safety reasons.
But I didn't
because
ask you
there's
to fill.
already-
I asked you to give me the price.
But I'm unable to
Correct.
give you I could give you the cash price if that's what you want, the cash price on it, but I'm unable to fill it. I'm unable to even put it through the system because I'm not gonna fill it. So
But you
So-
said something else for me that I have to have 90 days of the
they
same
want us
medication.
to check. Yes, the DEA came in
Ugh.
and they examined
Which
the
I never
store,
heard
the
about.
Drug Enforcement Agency, and for patient safety, they wanted us not to fill things too quickly, not to give a patient too much medicine. And they told us don't
No, but
even
it's
if the
not
doctor
that
says
we are
it's
asking.
okay, it's okay.
It's not what
it's
we're
okay.
asking. You said
No,
that.
I'm just
You
telling
said that I
what
cannot
happened.
change a medication. You said that I
If
have
you
to stay
the
with
supply,
that.
If you have the supply would have to be out. The supply
No,
would
that's
have to
not
be
what
out.
you said. You said that I
For 3
cannot
months.
change a medication for 3 months. That's what you
No,
told me.
Maybe you misunderstood what
Yeah,
I
I
said.
always misunderstand what you
Okay,
say.
I apologize for that if
Yeah.
you misunderstood. But the supply, if you had drug A, then drug A supply would have to be gone before drug B starts. And we look at that for 3 months. So if you have an extended
No, you
release
said that
medication-
I need to have. I cannot just change a medication like this.
just with if you still have the supply. That's how this
No,
store works.
that's not what you said.
Okay,
You
well, I
said that
apologize.
within 90 days.
Okay, that's what I said. That's what I
Yeah.
said. But what I
So you
what-
totally
what the-
changed your story now.
I don't believe that I did change my
Yeah.
story. Your understanding of it might be different.
Yeah.
But we go back 90 days. We have to go back 3 months for patient safety to make sure they don't have too much. And that's what the DEA.
You can go
and
10
that's
years.
what
I
the-
don't care. I'm clean.
Okay, I'm
I
not
never-
saying. I'm not saying.
No,
that
you
are.
said that you would like me to do business somewhere else.
I
That's
said
what you
if
said.
you need to get this medication right now, that's what you should do, sir. I need some help here. Security to the pharmacy, please. Sir, I'm going to call 911 because I feel threatened right now and I don't feel safe. So
Threaten? Why threaten? I'm just asking you a question.
I'm going to call the police if you don't leave. I don't feel safe here.
He hasn't done anything to threaten you in any way.
You're making me feel
I'm just
unsafe.
asking you a question.
You're intimidating
Let's go.
me and you're making me feel unsafe.
I'm not
I don't
intimidating
feel,
you.
You are. You're making me feel unsafe. I'm sorry.
You're gonna hear from my lawyer. Okay, just for you to know.
You're making me.
You're gonna hear from my lawyer.
You're threatening
I'm
me,
not
sir.
threatening. It's a thing.
Store manager to the pharmacy, please. Norma to the pharmacy.
What is that?